Hello, my name is Raven Peterson. I'm going to be conducting the musculoskeletal health assessment today. This is my patient. I'm going to start by asking my patient for her permission to record this and post it online for a school assignment. Do I have your permission?
Yes.
Good. Okay, so the test is going to cover 10 body parts or systems. We're going to start with the hands, go to the wrist, then the elbows, shoulders, neck, head, spine, hips, knees, ankles, and then toes and feet. So we'll start with the hands. With the hands, just starting with inspection, looking for any redness, looking for any deformities, any swelling, looking at the symmetry of both hands. Everything looks good. Next, you're going to move on to palpating the hands. You can start with the distal, move on to the proximal interphalangeal joints, and then you can move down to the metacarpals, and then move on to the carpals. You're going to do that with both hands, palpating just for any tenderness or any nodules or anything you can feel in those joint spaces. Next, with the hands, we're going to check their range of motion. So we will start by just having her make a fist, squeezing our fingers, good. And then now have you spread your hands all the way out, good. Now adduct your hands, other way is abducting. Great, so the hands have full range of motion. Next, we're going to move on to her wrists. And again, with the wrist, just starting with inspection, looking for the symmetry of the wrist, and then palpating the metacarpals and the carpal bones, and just checking for any tenderness, and then moving on to the range of motion. It should extend 90 degrees and then flex 90 degrees, good. Other hand, extend, good, flex, good. Excellent. So range of motion in the hands are good. Next, we'll do a specialty test of the wrist. The first specialty test is going to be a Tinel sign. So I'll have her extend her wrist to 90 degrees and then tap on her median nerve. And if she has any pain right there, that can mean some carpal tunnel. Do that both sides. Next is the Fallon test. And I'll have my patient push the wrist together at 90 degrees like this and hold that for 60 seconds, 40 to 60 seconds. If she experiences any pain on the inside of her wrist right there, that'd be a positive sign for carpal tunnel. Next, we're moving on to the elbows. Just inspecting the elbow, looking for any swelling, any masses, any sort of protrusion coming out of that elbow. So next, we'll go on to the palpation of the elbow, just feeling for any tenderness. Feeling the medial epicondyle, the lateral epicondyle, and then the olecranon process back here. Feeling for any tenderness. Is that tender at all? I'm doing that. Nope, good. I'll palpate both sides. And next, I'll check the range of motion. It should just be able to flex and extend, flex and extend. Good job. Full range of motion in those elbows. Next, I'll have you hold your hands out. And it should be able to pronate, supinate without any problems. Good job. Okay, moving on to the. Oh, you're also going to be palpating down the ulnar aspect of the arm here. I'm just feeling for any tenderness in both sides, and then also the radial side. Next, move on to the shoulders, just inspecting the anterior and posterior aspects of the shoulders, looking at the symmetry, looking for any abnormalities, any redness, swelling, really looking at the level of the shoulders. If one's dislocated or anything, it's going to be drooped down quite a ways. Next, we'll just palpate the shoulders, feeling for any tenderness. With the shoulders, you're going to be palpating the AC joint. Palpating the sternoclavicular area, and then palpating the what of the humerus, the something of the humerus, the side of the shoulder right here. And then next, we're going to check the range of motion in the shoulder. For the range of motion, I'm just going to have her flex her shoulders up as far as she can. Hopefully it's 180 degrees. Now she will extend her shoulders backwards about 60 degrees. Good. And then she can adduct her shoulders to her hips, and then abduct her shoulders at least 90 degrees there, and she can even go higher than that. Next, for the range of motion on the shoulders, I'll have her place her hands in the smalls of her back here. Good, and you can see that shoulder has good range of motion there. And go ahead and, okay, yep, and now take your hands and move them to the tops of your back. Good, and you can externally rotate your hands there. Good job. Next, we're going to move on. We'll move on to the spine from here. So I'll have my patient stand up and turn around. And with the spine, you're just starting with the inspection, of course. And with the inspection of the spine, you really want to look at the shoulders, making sure they're level, evenly placed, and resting. And also you're going to be looking at the hip placement, looking if one of the hips rested up higher or lower than the other. Next, you can palpate, palpating the spaces between those vertebrae, palpating the sides. You can really feel those muscles. If there's one side is, if they're even, if they got a hip drop, one side of that back muscle will be a lot tighter than the other. Also with the spine, we're going to want to check for any lordosis, kyphosis in the cervical and lumbar aspect of the back mostly. So these areas here. And then we will check her range of motion by having her twist. Good, should be good 30-degree angle twist both ways. Good. And then she should be able to bend this way. Good. Now bend the opposite way. Good. Then she should also be able to back bend. Okay, now forward bend. And while she's at this forward bend, we're just looking at her spine. This is the best time to check for scoliosis. So just checking for the alignment of the spine, checking for any curvature, especially around her thoracic region. She did not have any abnormalities in her spine, either in her range of motion or just the placement of it. Turning her back around, I forgot to mention this, we're going to check the range of motion. Well, actually, I skipped the whole entire head and neck, so go ahead and sit up here for me. So the head and neck assessment, just similar to shoulder, you're checking the placement of her shoulders. I'm checking the alignment of her neck. You can get a side view too, just checking for any abnormal curvature in the back of her neck here. And then this is where you're mostly palpating her trapezius muscles, coming back to her rhomboids, just looking at the even placement of all those muscle groups. And this is where you check the sternoclavicular area, kind of looking at the distribution of her chest and whatnot. So we'll do some range of motion things for the neck. And so the first range of motion, I will just have you stop. First range of motion, I'm going to have you twist your neck this way to the left, twist your neck to the right. Good. Come here. Get in there. Twisting your neck and then laterally moving her neck, taking her left ear to her left shoulder. Good, like that. And the opposite. Good. Now extend your neck, flex your chin to your chest. Good. So good range of motion in her neck. And we can do this compression test right here with the neck, having them tilt their head sideways and then kind of looking in a little bit. And then just applying pressure at the top of the head. And if that elicits any pain, that would be a positive sign. She did not have any pain. So next we are going to move on to her hips. For her hip assessment, it would probably be a good idea to see them standing. I already saw her standing and she did not have any unevenness or misalignment in her hips. So next I'm going to have her actually lay back on the bed. Well, actually, go ahead and stand up first. Right here is perfect. So I'm going to have you flex your hip upwards. Good. Now kind of come this way because you're also going to extend it backwards. Good. Now, same. Take that left leg and do that. Okay, now extend it. Good. Okay, come hop on the table.
Really?
Yep, go and lay down. So a couple tests for the hips to just check the tightness and how they lie. First, I'm just going to have the patient lift up the leg and then pull it to their chest, really. And what you're looking for here is the opposite leg lifting off the table. And if that opposite leg is lifting off the table and there's a lot of curvature in the knee, that's going to show tightness in the iliopsoas area. And her leg doesn't have any lift. If it did have any lift, we could measure the degree of that knee turn. So go and do the opposite. Wonderful. And this next test, what I'm going to do here is just have you place your foot right there, and I'm going to push up here and then push down this leg, and the legs should be able to be pushed evenly to the same height. If the testing leg does not fall to the same level as the opposite leg, that would be a positive sign. Also showing tightness in the psoas area. And we're going to do it to the opposite side here. So both negative. And also with the hip, you're just going to be palpating for the ASIS, right around this region, palpating for any tenderness, the posterior sacroiliac joint, and then any tenderness when I did that?
Nope.
Okay, good. Next, we're going to move on to the knees, and with the knees, just inspecting their alignment, looking for valgus or varus placement, looking for any swelling, any redness, any deformities of the knee. I do not see any. Next, we can move on to palpating the knee, feeling for any tenderness, feeling around the patella, the sides of the patella, feeling this popliteal fossa back here, just palpating for any tenderness. Does that hurt? No. Okay, good. And then next, we're going to check. The next thing we're going to do with the knee is check for a valgus sign. And valgus sign is testing for the medial, the MCL integrity. And so with the valgus, I'm going to have the patient about 20 degree flexed, and I am just going to be pushing on the thigh inward, pushing it medial, and then pulling out on the lower leg. Is that eliciting any pain? Is that comfortable at all? Good. And again, that's checking for the MCL strength. Move on to the opposite leg, do it again. Any pain? Good. Next is the Vera test, so it's going to just be opposite than that, and we're going to be pushing outward on the thigh and pulling inward on the lower leg, and it's just checking for the integrity of the LCL. Do it the opposite way. Good. Next, what we're going to do is a Latchman's test, and that's checking the integrity of the ACL. And with the Latchman's test, we're just going to have the patient bend their knee about 20 degrees again. And with this, I'm just going to have one arm placed on the thigh, one on the lower leg, and just pulling out on that lower leg quickly, and just seeing if I have any forward movement of the tibia from the femur. Like this here. All right. And there was there was little wiggle room in the knee joint there. Next is going to be a very similar test. We'll have the patient about 90 degrees in the bed, and I'm going to sit on their foot. And the same thing, I'm just pulling out on this lower leg. And I'm just looking for any tibial displacement, forward motion that is signifying any ACL damage. And I will do that to both legs, and she's not showing any issues with that there. Next, we're just checking the range of motion of the knees, and so go ahead and sit up on this part again. Thank you. Gosh, where was I? Okay. What was everything?
Range of motion.
Range of motion. Okay. So range of motion, just having her flex, good, and that should come to about 0 degrees, and then no, this is flex. Go ahead and extend. Go ahead and extend. Yeah, that should come to 0 degrees, both legs. Good, and we should do that passive and active. So there's passive. There's passive, and then having her do is going to be active. Yeah, go ahead and stand. Now just do knee to your butt, both legs. Good. Now check it passively also. And go ahead and stand up. Sit here for me again. So last we're going to move on to the ankles and the feet. I can't get that too low.
Down or something?
No, this is perfect right here.
Okay.
So for the ankles, just inspecting, looking at the feet and ankles, looking for any bunions, looking for any abnormal placement of the foot from the ankle, looking for any swelling, redness, anything of that sort. Next, you're just going to palpate. You're going to palpate the malleolus, just palpate the top of the foot, palpate the bottom of the tibia down here, and then also palpating the Achilles on both sides. Any tenderness when I do that? Okay, next we're going to check the range of motion in the foot, both passive and active. So I will do a hip for her, and then now have her move your foot up and down. Good. Yep, and then also twisting the foot inward and outward, and then also in circles. Any pain on that? Nope. Okay, so checking the range of motion, moving the foot up, down. That was active. Now we'll do passive, then twisting, inverting, everting. Good. And then also when you're palpating, I'll take your socks off really quick. Palpating the tarsals, palpating the metatarsals, moving on down to the phalanges, and just checking those joint areas for any tenderness, any swelling. Looking for any calluses, mostly on the feet, looking for calluses on the hands also. But anything concerning, and I do not see anything. So that concludes my musculoskeletal exam. Thank you for watching.